Hey, yeah, haven't done a video in a while, and I'd kind of thought maybe my journey with the whole ulcerative colitis thing was coming to the end, but apparently not. So about 3 weeks ago, I started getting a bit of a tummy ache, and I thought maybe it was just a blockage was happening, and so kind of waited, did the normal things that you would do with a blockage, like a hot water bottle and massaging my tummy and things, and it just wasn't getting any better. And yeah, just was really out of control, painful, and I was feeling really sick as well. So I went to hospital and they admitted me, and they thought maybe it was a blockage as well, and so they waited a few days to see whether it would resolve itself. But it wasn't doing, and I was being sick as well. So I had to have an NG tube down, which is something I've never had done before. It's really weird. It kind of feels like, you know, after a nosebleed you've got like a clot if you swallow a clot, like something out of your nose into your throat. That's what it felt like, having it pushed in. So it was horrible, but yeah, it didn't clear itself, and I had an X-ray and a CT scan done, and they said that it looked like my small intestine had kinked or something. So they yeah, waited for it to clear itself, but after a couple of days it hadn't, so they decided to do like emergency open surgery. So I think it's called a laparotomy or something, when they open you up all the way down through your belly button. So they did that and found that I had a volvulus of the small intestine, which apparently means your small intestine is twisted, and they don't really know why it happened, but they said that it could be adhesions or lack of adhesions, because I've had all my other surgeries done before, keyhole. There wouldn't have been very many scars to like hold everything in place, whereas now I've had open surgery, there'll be more scars. So maybe that will hold things in place so it won't twist again. Apparently it's really rare for it to happen anyway, but now it's even more unlikely because of having the open surgery. So yeah, it was quite unexpected, and obviously like it was like the Saturday I was feeling completely fine, and then the Sunday I was in hospital in lots of pain, really ill. And then by the Wednesday I was having open surgery. So, and then obviously I've been off work since then, recovering, you know, dealing with the wound, and having to kind of almost like have a new stoma, because in the surgery they had to cut out my old stoma to untwist the bowel and then create a new stoma. So although it's in the same place on my tummy, it's a new stoma, so it acts differently to my old one. I've had to like just have a really plain diet all over again, and then reintroduce things slowly. So yeah, I've done that, but it was kind of mostly like psychological. I think it kind of messed me up, because I thought, yeah, everything was done and I was in control again, and I loved having my stoma because I was, yeah, in control and not afraid of getting poorly again. And then all of a sudden this has happened, and I didn't even know it was a possibility. Like, I didn't know your small intestine could just twist by itself. Like, and I asked the doctor, like, was there anything I did, was there anything I ate or exercise or anything that I did to like cause it to happen? And he said no, it just has happened. So that was worrying, and it kind of made me feel like, well, now whenever I have a tummy ache I'll just be thinking, oh god, like, is my small intestine twisting again? Like, am I going to end up in hospital? And yeah, it's really hard. I think as well this surgery was quite hard because my other ones were planned, so it was like, you know, I was in control, I was planning that, and I was choosing that to happen almost. And it was keyhole, and I was ready for it, and I was well up until that surgery, so I'd had like pre-ops and stuff, whereas this was like all of a sudden like, oh, you need open surgery, and it was a lot bigger wound. So it was like, you know, I'd kind of all healed and my scars were doing nicely, and like to reward myself for being like getting through like 2 years after my surgery, I had my belly button pierced again, and I was like really happy that, yay, I had my body back, and you know, I'd got back into shape and stuff like that, and then all of a sudden that was cut through, so piercing doesn't exist anymore. And yeah, so I just think that will take a while, I think, to sink in that that's happened and it was out of my control and it could happen again. So yeah, that's difficult to like wrap my head around. And I think this surgery was difficult as well because when I woke up from the surgery I felt okay, and like there was a day where I was fine, I had some visitors, and then the following day I was really sick, and I was being sick and retching and just feeling really nauseous like all the time. I couldn't stand any food smells or any smells, and like I couldn't even drink water, so I had to go back on fluids and stuff. And yeah, I was really sick, and like the anti-sicknesses they were giving me didn't work, and I was just horribly sick for about 3 full days, and that was really hard. And like over the span of everything, I was in hospital for just over a week, but for a week straight I couldn't eat anything because obviously before I had a blockage, then I had surgery, and then I was being sick. So for a week straight I didn't eat. I didn't really get out of bed and like move around as much, so I lost lots of weight and I lost muscle mass, and so I became really weak. And so yeah, it was such a shock from being like completely fine, being at work, getting on with my life, and then all of a sudden being really weak, losing loads of weight, having a massive scar, having to like get used to a new stoma. It was just quite a big shock, and I don't think I'm fully like recognising it even now because it's kind of like too much to think about almost. But yeah, I'm feeling a lot better now. I did end up in hospital again this week because I don't know whether it's something I ate or whether it was just adhesions again or whatever, but I started having lots of pain just around my stoma. It was like every time the stoma moved or had output, it would be like really intense wave of pain. And again, I started to feel sick. I waited a few hours, did the normal things, and then I was sick, and so then I had to go into hospital, and they just had me overnight, so observed me, and it kind of corrected itself, and they said, yeah, it's probably just adhesions. But yeah, again, wasn't nice, and I was thinking, oh, here we go again, like, is it going to be another twist in the bowel? So I'm just going to really take it easy on like what I'm eating and stuff. So I don't know, it's been a big adventure, unexpected adventure. So at the moment I'm still signed off from work. I think I've got another week or so signed off, and I think maybe that will be around the right time frame to be off work, because I was thinking first of all, like, oh no, I'll be back before then, but it's just been the recovery and like getting strength back, and you know, it's been really quite knackering. I've had to like gradually walk a bit further every day and stuff like that just to build my leg muscles up again, and gradually put on weight again. So yeah, I think it'll be a bit right, like the right time frames, yeah. So I'll show you my tummy. I hope you can see from this angle. So this is obviously the wound. They've cut straight through my belly button. It's healing really nicely actually. Like this stuff around the wound, I don't know if you can see, is actually where my skin reacted to the like surgical glue that they put in, because they didn't have stitches or staples, they just glued it up on the outside. So yeah, my skin obviously had a reaction to that glue, and kind of had a rash on it, which is gradually going, but it's kind of scarred the skin, I guess, around the scar, so it's just taken a while to fade. And obviously my new stoma has stitches all around that will dissolve, but yeah, that's the wound. And again, it was kind of bummed me out, like, you know, another wound, another scar that I didn't ask for, but now it's looking a bit better. Like before it was really gross because it was healing, it scabbed over and everything, but now like, the scab's fallen off, it's looking alright. Like I'm sure once it fades I'll be used to it and whatever, like who cares. So yeah, that's my update of what's been happening recently. hopefully won't happen again. But yeah, I didn't know that it even could happen, so if anyone like watches this who's had a similar experience, then please let me know. And yeah, like let me know, did your doctors tell you anything different about like why it happened, or yeah, has it happened more than once? Yeah, let me know. Okay, bye bye.